Hello guys, it's Unit 3, Part I. Hello guys, today's topic is signs of pregnancy. Signs of pregnancy is actually divided into three, that is preconceptive, probable sign and positive sign. First, what is preconceptive sign? Preconceptive sign is nothing but the subjective data. The subjective data is what the complaint that we receive from the patient. At the time of pregnancy, patient do experience some kind of signs and symptoms like vomiting, nausea and all, and those complaints are nothing but preconceptive signs. Next, what is probable sign? When the patient comes to hospital, doctor do examine the patient, right? So at the time of examination, if the doctor sees any kind of sign and symptoms, those sign and symptoms are considered to be the probable sign. So probable sign is nothing but the sign and symptoms that is examined by the doctor or the nurse, and this is known as objective data or objective sign and symptoms. Next, positive sign. Positive sign is nothing but the sign and symptoms which indicates the fetal which is growing in the womb is healthy. Now first let's see the preconceptive sign, that is the complaints or the sign and symptoms that we receive from the mother at the time of pregnancy. In the time of pregnancies, all the women almost, they complain about amenorrhea. What is amenorrhea? That is nothing but the absence of menstruation. Next, nausea and vomiting. Nausea and vomiting is generally seen in 50% of women, and nausea and vomiting is generally felt at the early in the morning, that is soon after waking up mother do feel like vomiting, and that is also known as morning sickness. Next, enlargement of breast. Enlargement of breast is seen because after the birth of the baby, mother need to feed the baby, so enlargement of breast is seen. Increased urination. Increased urination is because when the baby is growing in the womb, the pressure on the bladder will be more. When the pressure on the bladder is more, then the urination will be frequently seen. That is increased urination. Next, fatigue and thylism. What is thylism? That is nothing but the saliva in the mouth is overproduced. Generally, at the time of pregnancy, you might be heard of these complaints like the mother generally feels like eating some kind of sour items like tamarind or some kind of mango. The mother do feel like eating some kind of sour items. It's because of this thylism. This is nothing but overproduction of saliva in the mouth. Montgomery tuberous growth, stretch mark, quickening. Okay, quickening is nothing but sudden fetal activity. If you place your hand on the womb in the second trimester, then you can feel this quickening. That is nothing but the fetal movement can be felt. Next, Chadwick sign. What is Chadwick sign? If you see the diagnosis of pregnancy, you will come to know what is Chadwick sign. That is nothing but the discoloration around the vagina. Colostrum from breast. Colostrum formation is also can be seen here. The probable sign. Probable sign is nothing but the sign and symptoms that is observed by the doctor at the time of examination. So what are the symptoms that doctor generally sees? Change in uterus. Uterus level will be changing month after month. Goodell sign. What is Goodell sign? Goodell sign is nothing but softening of the cervix. Braxton Hicks contraction. What is Braxton Hicks contraction? That is nothing but the irregular and infrequent and painless contraction. That is also known as false labor pain. Positive pregnancy test. When you are taking pregnancy test in the hospital, generally that comes positive because they are pregnant. And still there are many signs and symptoms generally can be seen like vaginal sign, uterine sign, Osender sign, Heger sign, and many more. If you see the diagnosis of the pregnancy, you'll get an idea about this. Before watching this video, please do watch diagnosis of pregnancy. Next, positive sign. What are positive signs? These are the signs that indicate that the baby is in the healthy way. The pregnancy is going in the healthy way. Okay, when you go to an hospital, doctor do examine you. At that time, there will be lots of examinations going on. And positive sign can be the result of those examinations. Like, what are the fetal heart rate? What are the fetal sound? What is the fetal heart tones? How the fetal is present in the womb? And how the fetal skeleton is visible in the X-ray, and what is ultrasound result. Is there any other deformities? Everything can be identified and those comes under positive signs. Questions will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video.